following is meant for information purposes only. Before taking any action on anything being discussed, consult your medical doctor. Welcome to Heart Health with board-certified cardiologist and internal medicine specialist, Dr. Franklin Weifald. Heart Health is a local call-in health show designed to educate and inform you of the most up-to-date information for not only maintaining a healthy heart, but a healthy body. Call us with your health questions at 919-860-9783.
And go ahead and call in quickly, 919-860-9783. I'm Dave Alexander. We have more doctors you can shake a stick at.
Well, the doctors are here. Yes, they are.
Dr. Franklin Weifald and Dr. Macon Singletary of North Raleigh Periodontics. Welcome, sir.
Thank you. Thank you. Glad to be here.
It's good to have you here. Got a couple of stories in the news that Dr. Weifald wanted Dr. Singletary to comment on, but again, I'm going to emphasize that the show works so much better with telephone calls. 919-860-9783. News came out about wine not being so bad for me.
Well, listen, this is the thing that I think talks about when we talk about the good studies and the not so good studies.
Okay.
And so I'm really interested in what Macon has to say. Some people put together, and these people were in the agricultural wine industry.
Well, of course.
They put together, they analyzed a bunch of the compounds in wine and said this compound A, this compound B will kill bacteria.
Yeah.
Therefore, it's a disinfectant, the wine is, and therefore, if you drink a lot of wine, you'll be healthier in terms of your gums. And so I wanted to know from Macon what he thinks about this. Yeah, if the study had been 5,000 people got wine and 5,000 people got water, and the wine people did better than the water people, then I'd believe it. But this is a situation where you've got some researchers who are telling you to drink a lot of wine on a theoretical basis. Okay. Well, what do you think about this, Macon?
Well, if they swish and spit, I think might be a good idea. I mean, Listerine's got alcohol in it, but
what's the deal on Listerine? Is that good?
Well, I try to avoid alcohol in patients. It eventually produces free radicals, and that can cause cancer. So I go all natural. The first bacteria ever seen by human eyes was enterobacteria. Antoine Longhow could discover the microscope. You know what he did? He dropped salt on the slide. The osmotic pressure caused the bacteria to explode. Saltwater rinse, swish and spit. It's cheap.
That's a great idea. Does the salt water have to be concentrated salt? Because I know that we have a certain percentage of salt that's the same as seawater. So when you talk about exploding them with salt, does that have to be a high concentration of salt or a normal concentration of salt?
That's a good question. I haven't seen research on it other than know. I usually tell patients to do a teaspoonful of salt in an 8-ounce glass of water, put it in the microwave for 30 seconds, let it dissolve. It'll stay dissolved. Swish 30 seconds and do that 3 or 4 times a day.
Yeah. So that is, I know this for a fact because I use saline solution to rinse my sinuses out. That's a whole different story. So what you're saying is twice the concentration of salt that you'd find in your own body. So that makes sense because what you're doing with this high concentration of salt is that the bacteria have the same normal concentration of salt that we have. So the water's going to go flying out of there and it's going to explode.
Anybody with an injury to their mouth knows that, you get that is so hard to get under control. Just the discomfort of it.
Exactly.
Salt seems to help.
So this is an important thing then. Instead of dousing your mouth with wine that's unproven, go ahead and do a natural, it's called hyperosmolar rinse. Tell us how we do that. What you put the teaspoon in the 8 ounces, you put it in the microwave, you dissolve it. How long do you keep it in your mouth? You swish it. You obviously don't want to swallow it, right?
Well, it hurt to swallow it, but I swish. People who have sodium-restricted diets, you want to swish 30 seconds and spit.
Okay, and you don't rinse your mouth out afterwards.
No,
you just leave it on.
Leave it there.
Wow.
Am I correct? Because, let's put it this way. Is Dr. Weifald correct that a lot of other body problems, a lot of disease can be a factor, can be caused by poor dental health? And
I agree with that situation. I know Macon does, too.
What do you think?
We've got an article here about colon polyps, but I know for a fact that heart health is much better when your gums and your teeth are in good shape, and it's much worse than when they're in bad shape.
Yeah, the study you referred to about the colon polyps, they did a study. I saw the research.
Right.
It's sort of bona fide research.
I think so, too.
They talked about the problem with polyps was inversely proportional to how many times they had the teeth cleaned. So
Right.
the more they had the teeth cleaned, the less they saw polyps.
Yeah, and so do you think what they hypothesized is something called the biofilm?
Mm-hmm.
So that's a collection of bacteria that turn into a gelatinous piece of material, and this bacteria can travel through the gut and is associated with the development of polyps. I think it's also inflammation. I mean, the more bacteria that are living in your gums and staying in there and chewing up everything, the body has to respond to that in an immune response, and that immune response is constantly activated, and you get more inflammation.
Okay, gentlemen, how do we get more people into the dentist? Because honestly, for me and for some members of my family, talking them in to go to the dentist, it's like literally dental surgery. I mean, when you are a metaphor for not wanting to do something, you got to work to get people in.
How painful is the stuff you do?
Oh, I'm gentle and painless.
Oh, good.
Great. What do you do to make yourself painless? Well, not you painless, but what you do painless.
Well, I just, I tell, first of all, to get people in, I tell them, you used to brush and floss to prevent decay or gum tissue health. I tell patients now it's their overall health. And it's real simple. The two most important parts of maintaining gum tissue health are what you do at home and your cleanings. And a cleaning it can be gentle and painless. And you just have to talk to the operator and say, hey, look, I'm a dental phobic. I've got a video of my first experience with the dentist. I went one time when I was 8 years old.
You have a video of you at the dentist?
No, discussing my first experience.
Oh, okay, discussing it.
Yeah, and the next time
I have a video of my first experience.
Oh, sure you do.
Well, this would be ugly because I ran out. I ran out
With the dentist.
They took that medieval torture device. You check for decay.
Yes.
It hurt. Yeah, and you got the street light there and the porcelain bowl with the water trickling around that makes you pee. And then then he says he turns around. They didn't teach him psychology in those days. So I'm 8 years old. He turns around. He's fumbling in that mini drawer green cabinet. He turns around and looks at me with the syringe and says, "Do you want this?" I said, no, that's for horses. You're not going to put that in my mouth. So, he takes that belt-driven handpiece. He hits the dent, and I hit the floor. I'm out of there. That 1960s Pontiac station wagon with the wings. I lock the door. My mom comes out. She's, what you doing? I said, I'm not going back in there.
I ain't going back there.
It took 3 of them to hold me down.
Oh, my gosh.
The next time I'm in the dental chair, I'm in dental school. So I sympathize with it.
Yes.
Oh, my God. Well, what do you do? I mean, what are your steps to take to make what you do not painful and not something that's going to make people want to run?
Well, first of all, is knowledge. Understanding what you're going to do. Because they fear, people have great imagination. They come in and think I'm going to do a frontal lobotomy. So I try to.
That might be a bad idea.
That's true. But then discuss exactly what the steps of the procedure, and this is what I'm going to use. I used to use IV sedation. I rarely do it anymore because most of my patients come in, if they're apprehensive, I have ways of talking to them. And
so it's basically talk therapy that you do before you start.
Yeah.
What about the use of benzodiazepines orally before they come in?
It's an adjunct, definitely.
Do you see a lot of patients' blood pressures really high when they first come in?
Yes.
Yeah. So what I tell that's a reactive thing. You're scared, your adrenaline goes up.
Amen.
So when I have people who do that and they can't stop, there's a medicine called clonidine. Okay, and you take it an hour before you go in, and it prevents that adrenaline surge for a short period of time. And I've had people who were refused surgery like 5 times in a row, even though their blood pressures were under control. Yeah. They had this reactive hypertension, and they basically took a clonidine an hour before. Now, don't do this without your doctor's approval because clonidine may not be good for you. But what do you do when somebody comes in and their blood pressure's through the roof before do you wait a little bit? Do you talk to them? What do you do?
Well, if their lower blood pressure, the diastolic is above 110, I won't do anything. Or
listen, some dentists won't do anything 160 over 90, so that's a good thing.
Yeah, but I talked to them. Did you take your blood pressure medication? I'll take it again. It depends on the procedure I'm going to do. I had one fella came in. It was a 200 over 140. I said, well, you go to your doctor now. And the doctor said if he hadn't gone, he would have had a.
Well, that's
aneurysm.
good. But I think that's one of the biggest problems I see is patients get sent from the dentist office because their blood pressure was out of control.
Right.
But in my office where everybody's calm, right? Yeah, sure. It's normal. So this is a big problem. And the way I treat that is to give them some clonidine an hour before they go in.
Mm-hmm.
He's Dr. Macon Singletary. The practice is called North Raleigh Periodontics. Are you the only one?
I'm the only one in the shop.
Only one in the shop.
I love that. We are a dying breed.
The two of you, you're the only.
A one-man shop. I was president of a 24-man group at one time, and now I used to say my lonesome, but now I've got 12 people.
Yeah.
We're a team, and I'm the only doctor, and it's great. What do you think?
Oh, it's awesome. It's the one-on-one. I got a great staff. It can get complicated. I try to keep it simple. We're family oriented, and we want people to come in and think that they're being paid attention to, not being run through a shop.
Yeah, and I have other patients who come to me for that reason, and they say, I went to my doctor, he wasn't there. I saw somebody else, and then the next time I went, he wasn't there or she wasn't there, and I saw a completely different person. Yeah. Then the fourth time I saw the PA, and then the seventh time nobody was there. I mean, it's just crazy. So I don't have anybody except me. And I think Macon's got the same feeling. Now, we're a dying breed. Why is that? Because the insurance companies and the hospitals, they want hugeness. For some reason, they think a large number of people will somehow save them costs. But I don't know if you know this, but when you go to a physician who has an office in the hospital, there's something called a facilities fee. And they're allowed to charge an extra $125 because you're going to see them in a hospital setting. So if you come to a private practitioner, even if it's a private practice with 2 or 3 doctors, you're automatically saving $125 for your visit.
Very cool.
How much insurance do you have to do?
Oh, my gosh.
Well, in terms of what I accept, it's just about 75%, 80% of my patients.
I don't have dental insurance. I just don't. I've never found it to be useful. I mean, do you recommend people getting dental insurance?
It depends. Not really. You have to sort of look at the situation, see what's going on, and how involved you are. That's sort of what we do in our office is, analyze what's going on with the patient and try to gear them. This is going to take a lot, this may not. But, the deal with dental insurance is it cuts our fees almost a third. And then, Well, I'm going to go out on a limb. Yeah. And
I'm going to say that Medicare should pay for dental work. I think so. We just talked about how important that is for overall health. Just imagine that investment in getting people's teeth better, reducing the need for a stent, reducing the need for colon cancer surgery. Mm-hmm. And so I'm going to go out on a limb here and say we should expand Medicare to cover dentistry.
Well, and I think preventive-wise, like for cleanings. For sure.
That's what I'm saying.
Yeah.
And even, if somebody's got a mouthful of bad teeth, and that's been going on for a long time, they should get dental care because it's going to help their entire body.
Oh, yeah.
Absolutely.
All right. Gentlemen, I know that you would talk shop all day.
Well,
we don't really have all day.
The gums and the heart are one.
They are.
Oh, yeah.
All right. Very good. Dr. Macon Singletary, thank you very much. The website is North Raleigh Perio, Perio.com, and go to it and check out the About page and see all the staff there. Thank you.
Yeah,
thank you.